is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to one of our initiative of Leadership Talks, where we interact with experts, leaders of healthcare industry who are constantly working to make healthcare accessible, affordable, and available for all. And for today's session, we have with us Ms. Prachi Garg, who is Market Access Policy and Communications Lead at Organon, a global healthcare company focused on improving the health for women. So, on the occasion of International Day of Action for Women's Health, we'll be focusing on women's health awareness. And the theme for the day is mobilizing in critical times of threats and opportunity, which emphasizes on empowering women to make decisions independently, free from coercion and discrimination. Welcome to our show, Prachi. How are you?
I'm doing well, Simran. Thank you very much.
Thanks a lot for connecting and coming to the platform where we can freely discuss about women's health and the awareness they have at this point of time. So I have lots of questions in my mind, but I would like to start with, I want to know, I had this doubt in my mind when I was going through the profiles and I got to know about Organon. So I want to know, what are the women's wellness products currently offered by Organon?
Thanks for the question, Simran. I would like to start with congratulating you for setting up this wonderful initiative on Voice of Healthcare and putting women on the agenda. Organon is a global healthcare company, and we have with a worldwide presence, and we are the only company of this size who are exclusively focused on women's health in terms of our vision, mission, and our portfolio. Organon in India largely has its portfolio in 4 domains at the moment. That is fertility, postpartum hemorrhage, family planning, and menopause. You could say our portfolio spans from menarche to menopause. For family planning, we have 4 drugs in our portfolio, which include daily pills, progesterone-based pills for breastfeeding mothers. Then we have contraception implants. In fertility space, we have 2 IVF medicines in our portfolio. We also have a product for hormone replacement therapy for women going through the menopausal phase in their lives. And in coming later this year, we are looking at launching a device for managing postpartum hemorrhage, which would be one of the first innovations we will launch since we have formed a new company.
That's great. I have this another question when you were talking about this. So how is Organon standing out in the market with their product which they're currently offering?
That's a very interesting question, Simran. Organon, actually, if you would look at it, our current portfolio and the way we are shaping our future portfolio is based on what women want. So we are constantly listening to women, and also listening to women's healthcare needs is helping us shape what we do. And if you look at the products in our family planning portfolio, in PPH space, there are innovations which are outstanding in quality and which basically provide quality services to women who need it. So in terms of quality, in terms of innovation, we are standing out.
Yeah, and I think in that way, if actually an organization is building products and what actually the audience want, they are in the correct line of how they are working and moving ahead. And at this point of time, it is very essential to prioritize women's reproductive health because there's so many changes happening rapidly, and people are not much aware of how they can take this forward. So I would like to know, why is it essential to prioritize women's reproductive health and wellness at this point of time?
So Simran, if we just talk about prioritization, we know women are half of the universe. They basically half of the population. They also are very foundational to how our society operates. And when we prioritize health, we basically prioritize overall well-being for everyone. So if you look at the Sustainable Development Goals, pretty much which every country has a signatory to, including India, if we look at other development indices, women and child health is at the core of not just health and nutrition indicators, but in terms of poverty elevation, gender equality, education, and a wide range of indicators. So when we make sure that women have services and at that quality services available which caters to their reproductive health, we don't just make a woman healthy, we make the child as well as child healthy as well. And a healthier woman and a healthier child builds a healthier family. So it tends to have a larger social impact and also tends to have an intergenerational impact. Every healthy and educated generation leads to a healthier and more educated next generation. So I think focusing on women's health and well-being has a long-term consequence on the society, not just on our health individually.
You said it right, because it, like you said, it explains the well-being of a family. If a woman is healthy, the next generation is, tends to be more healthy. If the health of women is, is take care well. But I believe there are a lot more barriers when it comes to women's reproductive wellness or the awareness. People are not aware of it. There are still this misconception and myths around all such things. So, what are the strategies that you guys are employing to address these barriers to women's reproductive wellness?
So, if you remember the first question that you asked me, it was around why it is important to prioritize, and your answer lies in that the word itself. So, women tend to deprioritize their own health. So does the family and society. And there are a lot of factors linked to that deprioritization, which is one is inequality in all walks of life. Women have lower agency, they have, in terms of social, economic empowerment and education, they are not equal. They experience inequity and inequality there. Poverty is one of the factors. Convenient access to money and convenient access to services, that too respectful services, is a big barrier to women accessing healthcare services, accessing to, of course, final resources, gender gap, gender-based violence, gender-based discrimination, economic and digital divide. All these are factors which take women, that prevent women from accessing services. So I believe we need a very multifaceted, comprehensive strategy to make sure that every woman has access to services. And how I visualize it, if I have to visualize it, what I think that we have to work on both demand and supply levels. In terms of demand, what we need to do, we need to empower her with education and information. And in that step, digital divide that we have, which is widened in India, we need to bridge that. We need to make sure more and more women have, when they want to find information, they can talk to somebody or they can go to the internet and find information on what services, where to find those services, how to get there, how much they'll cost. They should have that service. So once we have demand side plugged in, we need to work on the supply side as well. And for making the supply side foolproof, we need to make sure that companies like us and the public sector, they both come together. So I'll just give you an example. For instance, pharma companies like us, we should be focusing and investing on creating portfolio which suits women's healthcare needs. We should continue to invest more and more money into healthcare research which is relevant to women. which is still not optimum if you look at the total focus on women's health medicines globally. Second is we should be gearing our health services to be more friendly for women. So one, they should be closer to home. They should be respectful. We see a lot of challenges around respectful care for women. They are often judged for when they try to seek sexual health services, reproductive and sexual health services. So that's where women need space to express themselves fully, and that can only happen when the services are respectful. We also want to make sure that health systems are set such so that uh, uh, economic ability to pay is not a barrier. So we need to look at how the health services are structured. So we need to basically, I think, empowerment of women to demand services, and at the same time gearing up of healthcare providers, and together is very important. This can be brought together only with strong policy environment which looks at women's health in a comprehensive way. So I would say we need to look at the entire ecosystem to make sure every woman can go to the doctor when she needs it. And last but not the least, I would say male participation would do wonders in this situation.
Yeah, you said it right. The empowerment and to meet the demand and supply and the male participation in this actually makes a lot of difference when it comes to women's reproductive health, and it comes with awareness. The campaigns we can do, and one of them is what we are doing as of right now, talking and explaining things about this. But there's still a gap when we talk about women's reproductive health wellness to rural population. There's lack of awareness, there's lack of male participation. Women are not being empowered there. So I think there's very so much of difference as compared to the urban areas we are living in. So how can women's reproductive health and wellness be accessible to the rural population of our country?
Yeah, I think it would not be totally fair to say that urban women have it all. But yes, rural women have their unique set of challenges because not every kind of healthcare is reaching to rural and remote areas. I would say that India's health system, especially the public health system, is structured in a way that it can reach very remote areas, even media dark areas where, and we have a whole cadre of frontline workers like Ashas who have capability of taking healthcare services door to door. We have a wonderful uh, uh, ecosystem of self-help groups also in India, which we have leveraged in several healthcare programs of the government. I think what we need to do, we need to capitalize on what we have. And we can also look at public-private partnerships to make this happen.
Yeah.
And now with the several policy reforms and fast improving technology, telemedicine is, of course, one area which we still need to uh, uh, leverage upon to maximize access in remote areas. But I would say that if non-profit partners and government and private partners can work together, we can leverage on government's uh, ecosystem to take services to really remote areas.
Yes, that way, when there's public-private partnership and NGOs working together to the cause, through the help of that, we can reach the rural areas. Because internet and awareness campaigns like this, which are visible, these kind of interview sessions can work for the urban areas.
Yeah.
But to actually reach on the ground where people are not much aware of this, the access of all these things, or they don't use these kind of things, like they don't go and watch for the interview sessions and go for this search of the cause or the disease which we're talking about. So to reach on the ground there is very necessary, and that's how we can make impact. And that way, public-private partnership can make a great impact on that. But there would be a long-term goals for improving women's wellness health worldwide. So in terms of that, what do you think is that?
I would think about it in, like I said earlier, it's it's the ecosystem we need to nurture.
Hmm.
And in terms of long-term goals, uh, we need to improve access and ability to pay. And we can learn from several mature health systems uh, in different countries to to see what is most suitable for India. That's number one. Uh, of course, there the world need more companies like Organon to come up with uh, services and medicines which cater to women's healthcare needs, which are constantly studying them. Uh, we have, for instance, we have also learned that cardiovascular diseases for which there's no dearth of medicines, other chronic diseases as well. We know that fewer women are able to reach doctors compared to men on time or early enough. So I think what we need to work on is also demand generation. We need to make women aware of their healthcare needs and also encourage them to prioritize them. Um, I think it's a it's a it's a full ecosystem which we must nurture, where women are educated, they are empowered, they are making their own decisions and choices, and then there are providers who are there to provide them services.
And I think in that ecosystem, there is a lot of players involved which are working together and making that difference and reaching out to women about their wellness and the awareness on their reproductive health. So, if I have to ask about how does Organon plan to expand its reach and impact in the women's health market on that aspect?
So I think collaboration and partnership is our mantra for India.
Okay.
We are already working with, and we would like to continue um, to work with government and private sector, other and non corporate partners such as NGOs, civil society organizations, to make sure that more and more women come to the fold of healthcare services and they have access to innovations and quality standard of care. Second, we would, of course, as we are doing, continue to invest in R&D in women's health. We are also as a business, internally, we are constantly building a business environment which is pro women. So we are making sure that our gender ratio within the organization is always positive. Our culture is relatively feministic in nature. So we are also both internally conscious as well. Our ESG investments are towards women's health, and we would continue to focus on making sure that everything that we do contributes to our mission of making a healthier every day for every woman.
And I think that way we can reach to the masses and actually can create an impact.
Absolutely. I think it's what they say is it takes a village to raise a child, but I also feel that it takes everybody in the ecosystem to make sure that healthcare services are available.
Yes, yes, that's correct. So if I have to ask that how can individuals and organization together, you guys are doing your part, but how can we collectively, when I talk about we, I talk about individual organizations, NGOs, government, and all the other kind of entities available, can participate to support and empower women's health and wellness and can create an impact and raise awareness about this.
So Simran, the first step to that is somebody like you, a young person in media, taking the message to so many others is a very vital step. What I feel most passionate about is youth, because I feel young people in the country are most vulnerable. Their ability to access healthcare is limited. And that's where we would want more civil society action to happen. If you just look at the youth population from reproductive health point of view, there's a significant amount of young people still becoming parents in India, and malnutrition, anemia prevalence is a big problem in the country. We have some wonderful youth groups in India like YRG Care, etc. So I would think that such civil society organizations should come together and collaborate with organizations like us to uh, amplify the messaging. We would be very, I think that would be an ideal case scenario. And my thinking is focusing on youth and getting you to participate actively in their healthcare dialogue is is a long-term solution, because uh, the youth today will be the adult of tomorrow, and how they will raise their children will change several next generations.
You said it right, because what we'll do will impact our coming generation, the next generation. And youth has the power to make that change, to make that happen. If collectively we all are working for it, I'm not sure about, yeah, we can make a difference to our generation, but we can definitely create an impact and change and can create a better world and environment for the coming generation.
Yeah, I mean, youth like you are more media savvy, they're more technology savvy. So it is easier to reach them. So I think all of us must come up with strategies to make sure that they are actively participating, asking for services, looking out for services. And young women will can make so much more difference if they start making their own choices and having their own plans.
You said it right, and we all have that freedom to make it, and we'll make it. We'll do our part. We'll create awareness in whatever ways we can. We'll try to make the impact and bring that in society for a better world, for a better tomorrow. And that's what I guess Organon is doing, and trying to make that impact, creating a better world for the women out there to, respect, and telling people to respect their choices. It's their health, their wellness. And it is very important for women to take care of their reproductive health. That's how we would have a healthy family and a better generation.
Absolutely. Yeah.
It's a great message which we got out of our conversation. And thank you so much for joining in for the conversation. You know, the message we wanted to deliver is a stronger message, and I believe listeners out there would get this from our interview, our conversation, and will make that change happen.
Wonderful, Simran. Thank you. Thank you for giving us the opportunity to interact with you and take our message to a wider set of audience.